What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome to you. If you've been here for a while, watch the video, maybe even liked and subscribed, I appreciate you and welcome back. So, I've been asked a couple times to do this video and I've been trying to figure out just kind of how to do it. And that was in regards to which pads I was referring to in my incontinence videos. And I'm very, kind of in regards to talking about brands and stuff, I don't really like to do that. And that's just mostly because everybody's budget is not the same. And so I don't want to make it seem as though something is worse than or better than something else. It was just what my preference was. Of course, you get what you pay for. But the thing is that you need to consider that these are the things that I actually used and you can go get the same. But at the same time, you don't necessarily have to get these. Now, if you look at them, you kind of pause the video when you go to the store, you'll figure out what brand they are and you'll be able to get them accordingly. But the thing is that it's important that you get whatever it is that you feel comfortable with and that you use it appropriately. So, we're going to start off with what I called the small pad. So this is what I call the small pad, right? So this is what it's going to look like when you have it in your car, in the console, whether it's in some bag or something you have. Where this is really what it's going to look like. It's going to be in a bag. You're not even going to know what's in it. I mean, most women will consider that they know what it is, but most men not going to figure out what it is. So you should feel comfortable that, you have this. Now, I will tell you, this actually slides really well in your back pocket. So if you need it, take the small pad with you. Now, this is for everyday dribbles, meaning that you are using the restroom, maybe you're finishing, or maybe you have, your belt's too tight. Some of the stuff that happens where you're kind of having incontinence issues and you are trying to make sure that you're just safe on a day that you're not really having really bad incontinence, but, and so take into consideration, I'm speaking to all of you and some of you at the same time. I know that seems really weird, but what I'm saying to you is I am not speaking to the exception to the rule. I know that the exception to the rule is in very bad shape. And as such, I want to account for you, as I always do, and say that I am not saying that this will work for everyone. Right? So these small pads that I'm talking about are normally for individuals who don't have really bad incontinence. And this is for them as they continue to kind of wean off. Let's say, for instance, they had it really badly at first, and now they don't have it as badly now, but they want to feel safe at work. And a lot of times people will continue to wear this small pad after their incontinence issues are starting to get a little better until such time as they feel comfortable. So this is a small pad. You open it up, and this is what it looks like. It is a small pad. It goes in, it's very, very thin, gentlemen. Very, very thin. Now this blue in here, I am telling you that I have left one of these in the washing machine and it's come out and it has been full of water. Puffed all the way out to here. And this thing was holding. I have no idea how. I don't know what this is. But it was holding all of that water in out of the washing machine. It's really ridiculous. Make sure you take these out of your underwear when you're washing them. That's a pro tip. Because you do not want your significant other person finding these in the washing machine or finding these in your underwear. Alright. So this is what it looks like. It goes in. Now, that you guys, some of you asked me to show you how it goes in. Listen, I don't feel comfortable doing that just because I don't know what your circumstances. Okay, so this fits in. You want to make sure that you don't put it too low. If you put it too low in your underwear like this is where your penis needs to be, right? So this is what I'm talking about. If you are leaning one way or another, you need to make sure that when you set this pad up in your underwear, when your penis is docile or just kind of laying, that it is aimed towards the middle of this pad. Because it's thin right here, gentlemen, there's a tendency that if you put it too low, your penis is going to be seeping out to the side. It's going to be seeping out to the side. It's not going to be intentional, but it's going to be seeping out to the side. And this is going to cause you to have issues into your underwear. All right, so you want to make sure that wherever your penis is, this fat part right here, the fat part right here, is where it is, because this is where it's going to capture the urine and hold it. All right, so this is a small pad, daily for drips. Now, this is what I call a large pad. It looks just like this. It's a little thicker. All right, so when you first start off, you should have one of these. And if you are carrying a small pad with you, you should have one of these with you. You never know what the stimulus is going to be, gentlemen. Whether you have a cup of coffee or whether or not it's something else that you're taking or some medicine that causes you to go to the restroom a lot, you're not going to know necessarily which one of these until you get really comfortable in the process. Okay, so carrying one of these and putting it on and then not having one of these when you are going through the process and early in your outcomes, it's just not smart, gentlemen. It's just not smart. So this is what I call the large pad. This is the one that I wear when I'm traveling and in the car and I'm going up and down the road or whatever it is, just in case. I still have my urinal and stuff like that, but this one is just in case because this one's big. Now, it looks similar to a lady's pad, but it, again, is thick right here at the top, right? And again, this one is even worse than the other one. So when I look at these, it's still, if you look in here, this is where all of the urine would be captured. But because when you put it in your underwear, if my finger is your penis, the chances of your penis moving outside this pad are very, very high. So you may have to offset it, meaning that you don't put it right in the middle. You put it over towards the head of your penis so that your head of your penis rests where it's supposed to. A lot of times people are trying to put this where it is in the middle and it's flush. That's not going to work. Now, one of the things that I figured out early was performance briefs. So I was talking about get yourself some briefs in the video, and I was talking about just regular briefs. But the thing about regular briefs is that because the way they're built, they have a tendency to shift. The performance briefs bring everything up close. So it brings your pad up close, right? Brings your pad up close, and it has it in here so that everything is in here and there's no real chance for it to move. They're called performance briefs. Look into them. There are a number of them that you can find. Some of them are dry. They're cotton, but they're dry whisking. Like they keep moisture and they dry really fast. They're quick dry. So those may be helpful for you. All right. So look into those. Again, this pad and whether or not it works or not isn't just where you put this adhesive. It's also based on your underwear. I've had that discussion a couple of different times, but it's based on your underwear. If your underwear are loose enough where they're shifting, this pad's going to shift. And if you leak urine, you may miss it. You got to figure out, fellas, how to make sure that you have this pad. I'm telling you, it's like a losing battle when you actually have this in, you believe it's right, and then you still have an accident. And you don't want to do that. Get you some performance briefs, bring all of this up close, and keep this in here where it's supposed to be. Now, like I said in one of my comments, one of the things that you need to consider is that you need to make sure that you understand that this holds heat. It holds heat. And as such, there's going to be some moisture down there. Not only just whatever the incontinence issue that you have, but just regular moisture. You need to account for that. You need to try to keep that area dry so you don't end up with jockage or crotch rot or any of those things that can happen down there, because that's going to bring a different smell too. And that is not okay. All right. So you need to make sure you account for that. Account for the fact that you could potentially have a lot more heat down there in your performance briefs. It's not enough. It's not a whole lot of air that's coming in and out. Okay. Large pad, small pad. Now, when you are first going through your incontinence issues, this is going to be your friend. Especially at night. you're going to find that this particular this particular pull-up, and it looks just like pull-up, will go and be very, very good to you because you can wear it, and this thing holds a lot. Not that I ever wanted to see what it would hold, but this thing holds a lot. I know it does because you could pour some water in there and try it. I wouldn't recommend it. Just take my word for it. These things are expensive. Don't just go trying to figure it out by just getting one. Again, this one is the same situation. Now, I find myself, when I was having incontinence issues, I found myself in the same situation with this as I did these. My particular circumstance didn't fit all the way in here. It wasn't easy to have it in there because, like I said, these are not taking into account that a man's penis doesn't do this or that. Sometimes it lays down. And that when it lays down, they should have accounted for that. But I think that they put the specs for this off of what women and what they had created for women. And they just sent it out for men and never had accounted for the fact that this thing should probably be like this and not necessarily like that. It should cover all of our underwear to make sure that it holds. And they should have probably done something that would fit directly through what our underwear looks like. Because our underwear looks different than women's underwear. And because it's cut differently, this thing doesn't fit like it's supposed to. That's what everybody's issue is and how to put this in. It's because it is not cut appropriately. Now again, whether you wear this at night or whether or not you are in a circumstance where you got to wear this all the time or during the day, again, account for the heat. Try to make sure that you keep that area dry. Now, I used the jacket spray, a powder spray, to down there. I didn't use powder or any of that stuff because I did not want mixing all of that stuff up together. I mean, you're out of the house and you're not necessarily knowing what's going on and it's hot. Just try to use a powder spray. It goes on dry and you put it on during the morning and just try to mediate some of those issues because you don't want all of that stuff having to go where you have to go to the doctor and try to figure out the best way to get that done. So this one will work really well at night. For some of you, you're going to find you shifting this and all of a sudden you're just like, you know what, I'm going to have to figure it out. Now, there are some people combining these, right? There are some people that are putting this in this and they're putting them together. Not only is that expensive, I'm not sure if it's really going to work for you. But if you're putting out a lot of urine at night, you need to start looking at what it is that your intake is before bed. And that is because you need to mediate that at some point. As just a person that you're sitting there, you're like, you know what? I had this issue. You should figure it out. Figure out how much you drank, what it was, so that you can figure out how much you need to intake to just stay hydrated. And then also to make sure that you don't have a whole lot of urine to leak at night. It's just one of those things that you just need to consider and make sure that you are doing for you. Again, the more of these that you soil, the more it kind of chips away at you. I mean, it really does. I'm not saying that, we all who have had the radical prostatectomy, at some point or another, we've had these. Some of us have graduated out of them. Some of us have graduated to the smaller pad of the ones that we have here. But at the same time, you want to make sure that you are, if you're wearing these, that you are putting them in appropriately, selecting the right and correct underwear, and that you are measuring and knowing what your intake is. And again, the heat thing in the jacket, I'm telling you, you do not want that type of issue going on down there while you are having bad incontinence. It is something that is possible, and if you can mediate it, I would. So, I wanted to make sure that I showed these to you and made sure that I let everyone know that there are different brands that you can get. You can go to any of the stores. I will tell you, you get what you pay for. Get what you pay for. Some of them look alike. Some of them are better than others. So if you're in a budgeting situation where you have to get another brand that may or may not cost as much as another, just understand that brand may or may not be as strong as the one that you have. Again, I'm not sure because I didn't switch, but in other circumstances that has been the case. So, I tend to say that is something that I could put over there and say, oh, well, if it happened in this type of circumstance, then it probably happened in this one. Keep that in mind. All right, so listen, I know that all of you are struggling, some of you worse than others. Just hang in there, okay? This is one of our outcomes. It's worse for some people when you graduate out of this circumstance. It feels really, really good. And then some days you got to take one of these with you. It's never anything that you're really all the way out of. At least I don't feel like it. I mean, sometimes, you're not even thinking about it. 2 months, not even. And then all of a sudden, you have a stimulus or a stimuli something. And all of a sudden, you're back at it. Restroom, dribble. So, you guys hang in there. I'm wishing you all well. And peace and blessings, fellas.